last week we are up to the chilblain, right? Yeah. So today we're starting from the fungal infection. Okay. Share. Yeah, so last week up to the chilblain. Yeah, so normally the common site fungal infection is the acidic food. Yeah, I'm not sure whether you have acidic food. Yeah, I used to have that. Yeah. And normally fungal infection, we call it ringworm infection as well. So when you see ringworm, which mean is fungal，所以这个霉菌感染在英文里面，它可能会用这个 ringworm as well。你看到 ringworm，你不要以为它是一个什么虫。Yeah, ringworm is not a worm, it's a fungal infection. Okay, so ringworm, which is fungal infection, is contagious, caused by normally we call mold. Yeah, mold 就有点像有时候你说在墙壁上有时候看到一些那些发霉，墙壁上有那种黑黑的那种都是一种我们英文叫它 mold. It's a mold-like parasite. Okay, live on a cell. So normally it can be in our outer layer of the skin. So especially where the moisture, where the area attract more moisture, like under your like your armpit, or your groin. Sometimes your toenail. 好，那通常 the fungal infection normally you will see a red round like a ring. So when you saw the skin, the expression for the rash is look like a red ring in the outer area, and in the center is a bit light. Normally that is fungal infection. 所以这个霉菌感染，如果你看到那个表现是外围有一层圆圈，红色的圆圈，这些，然后中间是白白的，比较淡的颜色，这些都是 fungal infection. It doesn't matter. It comes in a small rash or bigger one. So you can see the middle picture. Middle picture is I think on your leg, but it's like a big ring. So you know that this is fungal infection. 还有这个yeah, you can see can be between your toes or something like. 所以霉菌感染基本上都是这样一个圆圆的不会是那种不规则形状的。So the shape normally is a bit regular, not like irregular. So it's like one shape. Okay, so irregular, round, oval or ring shape, which is why we call it ringworm infection. And normally you will see a lighter color in the center, and outer ring is a bit red. Okay, and it's itchy too, but it's not that itchy. Yeah, compared with dry skin and fungal infection, you can tell the difference when you ask the patient, do you feel very itchy or not that itchy? Normally, very itchy is not fungal infection. Very itchy, that it could be just a dry skin or something else. But for fungal infection, it's slightly itchy, 一点点，它不会是很痒这就是一般的那个的差别跟有时候你有那个皮肤一些痒那如果是 fungal infection, normally is slightly itchy. Yeah. 那 fungal, there are two different type of fungal. One we call it mold. The other one is yeast. 所以这 yeast 就是我们的所谓的酵母菌，所以酵母菌也是属于我们的属于一种我们 叫做霉菌的感染啊。那像霉菌、酵母菌，我们知道霉菌跟酵母在中文上，霉菌跟酵母菌基本上，霉菌是好像一个 big family， we call it fungal, but actually it comes in two different small family called yeast or mold. Okay, normally the athlete's foot is normally happen between the toes. Okay, and sometimes will affect your toenail. 所以香港脚基本上它的发生的地方都是在你的脚趾跟脚趾之间，哦，因为那个地方最多between the toes, or because in that area it tend to attract more moisture, so that's why normally the fungal infection just happen there. Okay, and normally on the market, you can see there's a Lamisil 疗霉素这个疗霉素的这个霉菌的卵的这个药膏。So one is called derma gel, and the other one is cream. Do you know which one to use, which area? Yeah. Normally for your foot or feet, normally we prefer to use the gel because gel can dry out. And normally if you put it on your feet and if you use cream, it will attract more moisture. 所以你什么时候会使用这个 gel，或者什么时候会使用这个 cream 呢？如果是在脚上面，因为你经常脚我们会 you normally wear socks, and the socks will keep the area keep the moisture, and especially you use the cream. Cream will tend to attract more moisture. 所以那个 cream 基本上会你涂在脚上是可以，但是如果你每天都要穿袜子的话，你那个 cream 呢它会吸附更多那个水分，所以你反而会觉得脚更湿，所以这个时候用 gel 可能会比较好。Okay, or for your scalp. Yeah, scalp, sometimes we use the gel will be better as a moisturizer if can moisturize the area. Okay, and in the pharmacy, you always have to be careful which cream can be used for pregnancy woman or breastfeeding lady. Cotramazole. Cotramazole is the category, pregnancy category is A. And also in lactation for breastfeeding is safe to use. 所以说唯一在这个临床上在药局里面可以卖的这个有怀孕的妇女，还有这个她如果有哺乳的话，只有这个成分 cotramazole. And normally cotramazole you use 3 times a day. But as a antifungal, this one is not that strong than Lamisil. So Lamisil 的 ingredient is called terbinafine. Terbinafine，刚刚我们说那个疗霉素有没有 ？Terbinafine is the main ingredient. But the Lamisil, the category for pregnancy is B or B3. 所以说 and also in breastfeeding, they're not recommended. Yeah. 虽然and for Lamisil or those bifonazole is normally once a day dose. 刚刚我们说那个什么 cotramazole is 3 times a day. But this one, Lamisil, 它很有效，但是就是一天一次就可以，而且通常 normally the whole course for the treatment is 7 days. After you apply for 7 days, normally we will recommend the patient to have another week, yeah, just to keep that don't happening again, yeah. 所以说7天虽然说是它的标准流程，但是我们有时候还是会建议说再用1个礼拜，这样子的话他就不会就容易断根啊。Okay, also for your groin 它长在 groin 的话，我们叫做 jockage. jock itch，对不对？这是我们一般的股癣，屁股或者是你的这个会阴啊，这个地方有很多的这些，它会很多湿气，所以说也容易长这个股癣。Okay, fungal infection. 刚刚我们说过 is ringworm. The shape, the rash look like is a circle, a round shape. 然后 you can look at the right, the picture. 这个东西你看到有一个这个 the rash is it looks like it's a big circle rash, right? This is steroid cream cause make the ringworm infection worse. So at the beginning, this fungal infection is just a very tiny spot, and if you don't know this is fungal infection, and you put the steroid cream, because 90% of the skin product or cream, they're all steroid based. If you use steroid base for long term, and the rash will keep growing and growing, and eventually you will be like this. 好，所以说，如果你一开始你不确定是这个霉菌感染，结果你使用了这个类固醇软膏，那这个小小的一个圆圈圈的这个 rash 就会慢慢扩大到整个身体。So to be on the safe side, normally, if you're not sure and you want to use the steroid, it's better to just add antifungal together. Yeah. I think in Australia we have the 2-in-1 product, steroid plus antifungal together. But be aware, be careful. Any products, any steroid product, always advise the patient to use for short term. Yeah, when I say short term, it's like 10 day, 7 day. If they want to reuse the steroid, it's better have a break, like a week before they reuse it. And some doctor, when they prescribe the steroid for the patient, and the patient didn't realize, and they keep using for months or even years. If there's a fungal or other bacterial infection involved, long-term use of the steroid cream or ointment can make the symptom worse. So always advise the patient when using steroid cream, short term, yeah，就是如果使用类固醇的软膏的话，尽量是短期的，unless doctor advise, okay, doctor say, oh, use for 1 month, 2 months, yeah. Otherwise, in the pharmacy, if you sell any steroid, always tell them short term. Okay. And fungal infection can also happen inside the mouth.
Sorry, Professor.
Pardon?
I mean, like, in terms of the steroids, as you're saying, you should use maybe for a shorter period of time, 7 days maybe. And
Correct.
in case maybe, let's say there is a certain combination of drugs whereby you need to use the other drug more than 7 days, but it's combined with steroids.
I think only when doctor advise. Some people can be on steroid for even a longer period of time. For certain skin condition, sometimes they probably will use for a bit longer. For the body may be okay, but for the face, if they want to use the steroid on the face, normally doctor wouldn't recommend any steroid on the face for long term. And to use steroid, it's better instead of using once a day or twice or every 2 days, it's better to use more intense than just only use once or twice a week. Yeah, you want to solve the problem. It's better like you use twice a day for 7 days. Then you use once a day or or 2 days, every 2 days, and you never finish, you never stop. Yeah. Yeah, it's better short term but intense than use forever. Yeah. And for the fungal infection inside the mouth, normally it's caused by Candidus 是一种念珠菌啊，念珠菌我们是 is a yeast infection， 就是一种酵母菌，它是一种酵母菌属的啊，但是常常发生在我们的嘴巴里面，它也是一种 is a like a normal bacterial. No, I wouldn't say bacteria. And normal yeast normally will be in the mouth, or for the lady normally we could happen in the vaginal area. So we call this fungal infection called thrush. So there's a two type of thrush: oral thrush or vaginal thrush. 啊，这个阴道念珠菌感染，我们一般就是叫做 vaginal thrush。所以你如果听到 thrush，this is fungal infection, mouth or for your vaginal。啊，那在 vaginal 就是中文我们说就是像有没有听过这种白带？白带啊，女生有白带，这个就是指的就是fungal infection。Okay. Oh, the same. So how to treat it? So this is some in Australia, but I'm not sure whether in Taiwan. Probably you have to see the doctor. But in Australia, there's an over-the-counter product. It's antifungal, like either drop. Is a drop, and normally you use one meal 4 times a day after food. And sometimes the fungal infection will happen on the nail. So that's most very hard to treat fungal infection. 如果说你的这个 fungal infection 是跟指甲有关系的，基本上它很难去靠一些这些if that is fungal infection on the toenail, yeah, it's very hard to use any topical cream to cure, because the nail is very thick, and normally the cream, antifungal cream, is very hard to penetrate to the nail matrix. So there's a product called Locerio. Locerio is something you have to file your nail. 你要那个治疗的时候，你要把你的那个指甲呢，把它磨掉，然后再涂上这个药。Normally is once a week application for this medication. Is quite toxic, so normally it's once a week. But before you use it, you have to file the nail, and it takes about 6 months. The whole course for the toenail is 6 months. Do you know how long to treat your fingernail, and how long to treat if you have fungal nail infection, toenail? Normally for the toenail is six months, at least 6 months, because it takes 6 months for your toenail to regrow. But for your fingernail, normally between 3 to 6 months. Yeah, because your toenail grows slower than your fingernail. 所以因为这是生长，你可能没有留意到我们指甲的生长的速度，我们的手的指甲跟脚的指甲是长的速度是不一样的，脚指甲长得很慢。所以说为什么脚指甲很难去治疗？因为你刚治疗好，然后那个霉菌又马上把那个等于说你等于是一直在那个你就是抗争的，就是你的指甲的长出来的速度跟霉菌它感染的速度，看哪一个比较快。But both of them can be used if you take oral antifungal drug like Lamisil, yeah, it's very effective. 口服的那个疗霉素，它很有效。But the side effect for the oral tablet Lamisil is they can cause your can increase the burden for your liver. So people on Lamisil, they need to take a liver function test. 如果说医生决定说，开口服药，口服药很有效啊，一定你只要有吃，它就绝对有效。但是就是它会伤肝，所以一定要做那个肝功能的测试。Okay, and
Hello,
Niels,
sorry.
yep.
I mean, maybe the previous slide, maybe in place of Ramasu, can we use also like maybe ketoconazole oral?
Ketoconazole. Ketoconazole is okay, but still similar. It can still no good for the liver. And ketoconazole, I think you have to use more often. Like it's not like once a day dose. Yeah, doctor can prescribe ketoconazole. Yeah, there's two different antifungal, ketoconazole or the Lamisil, terbinafine. Yeah, they all can be used. They all effective.
Okay.
But if you can use Lamisil, terbinafine, if your liver are good enough, Lamisil is always better, quicker. Yeah.
Okay.
Yeah.
Thank you.
And Neostat, Neostat is for antifungal. So on the left-hand side photo, that's the liquid, the drop I mentioned to treat oral thrush. And for on the right-hand side and the middle one, that's the cream. And normally you use that to treat either your skin fungal infection or vaginal vaginal thrush. But to treat vaginal thrush, normally there's an applicator. The lady need to put the dose internally inside the vaginal. 它这个治疗阴道的这个念珠菌感染，它有一个投药器，它必须要塞进你的阴道，然后把那个剂量给它挤出来。Okay, so this is Lamisil, yeah. Okay, and pregnancy and lactation and breastfeeding, lactation, clotrimazole, yeah, just is category A, lactation safe, and neostatin, category A. So, but terbinafine, Lamisil is not recommended for pregnancy and breastfeeding. Okay, so it's better we prevent. Prevention is always better than treatment. So how do we prevent the fungal infection? So you have to clean up your after you like you have a dirty, sweaty when especially when you after using the locker room or share normally in a swimming pool. Yeah, there's a lot of fungal infection chance. And don't share the comb or your brushes. Avoid having your skin or your feet wet or damp with long period of time. Always wear clean, loose-fitting underwear. Yeah. Okay, and also sometimes for your nappy or for your socks, for your clothes, if you have fungal infection like acidus foot, it's better when you do your laundry, you put that antiseptic. Yeah, it's called canestin, but the ingredient is benzalkonium chloride. Yeah, and this one's quite effective. It's not only you kill this one doesn't not only kill the fungal and also kill the bacteria. It's quite effective. Otherwise, if you just use the cream and if you don't clean your socks or your clothes, the problem will keep coming again and again. And nappy rash normally happen for the newborn baby, because for when you put the nappy on that area, tend to keep the moisture attract in the nappy. So normally the nappy rash can happen when the nappy material is not that good, and or if you don't change the baby's nappy frequently. And sometimes when the baby are teething, they have saliva production, and normally will cause the rash. And when baby have the diet change, they change the formula. There's a chance they might have the nappy rash happen. And that's how nappy rash look like. It's like bright red. So bright red mean that the area of the skin has been damaged. So you need to put a cream we call barrier cream. Normally the barrier cream is a zinc based barrier cream. Barrier cream will protect the area, will protect the skin from damaging. And also the ingredient for the barrier cream normally is a zinc oxide. Zinc oxide is the anti-itchy base 所以说我们在台湾可能会放那个什么放痱子粉啊，那痱子粉基本上也都是有类似的作用。那 zinc oxide 基本上它是一个保护皮肤，而且它可以有止痒的作用。Okay, and sometimes the nappy rash put fungal might kick in. Yeah， 就是说有时候你在尿布疹的时候久了以后那个你的霉菌就会 fungal infection 就会跑进来了。那这个时候呢，the rash will become bright red. If you see the red color of the skin become a bit bright red color, that is fungal infection. And normally, and especially when nappy rash persists for 3 days or more, yeah, you don't need to consider if there's any fungal. Definitely, that's fungal. Normally, nappy rash for 3 days, fungal. Okay, and bright red shiny skin. Okay, and hydrosol. This is a product with antifungal, cotrimazole, and also steroid. So when any product with steroid and with steroid, you need to advise the patient short term. So you not just only want to kill the bacteria and you want to reduce the inflammation, but make sure you tell them short term, a week. If you don't tell them, the patient will use forever. Yeah. Yeah, I have a lot of patients come in and say, oh, they've been using this cream, hydrosol cream, for like a couple of months. Yeah, that's no good. Yeah. Okay, and impetigo 就是它 impetigo 这个名字基本上就是有那种就是细菌的感染了所以说 it's caused by bacterial impetigo. So what kind of bacteria like streptococcus 这个化脓性的链球菌 or staphylococcus 金黄色葡萄球菌。那 it's normally we call this impetigo as school sore. School sore 的意思就是说在学校里面小朋友很常发生这些细菌的皮肤的感染。And normally it's also itchy as well. 然后 yeah, this is impetigo. So you can see there's a raised bump, and also you can see there's a could be a discharge, a pus inside 所以这些都是属于细菌感染 bacterial infection impetigo. So how do we treat the impetigo? So since we know the impetigo or the school sore is caused by bacteria, so antiseptic, especially betadine, over the counter, normally that is what we will recommend. 所以因为它是细菌感染，所以说这个优点，这个 betadine 是一个很好的一个东西哈。优点哈，这个 betadine is antibacterial and also antivirus. So when you have the cold sore 那个嘴巴长那个 cold sore 你也可以用 betadine, yeah, because it kill the bacteria too. Okay, so this is a steroid potency chart for as a pharmacist in the hospital. It doesn't matter in the hospital or in the community pharmacy setting. This chart is always important, yeah, because it's categorized the potency for steroid from low to ultra high. So the higher the steroids, you can it's more effective, but it can cause more side effect. 所以这个你们就看看就好了，因为这个对，如果你是你是当药师的话，这个在药局或者是一般的，都算是很重要。你要知道说，you have to know which steroid is belong to low potency or the high or medium, ultra high potency. Yeah. So this is for your reference. Yeah. Okay, and let's do a case. Yeah. Mr. Wang's daughter-in-law bring her son to the pharmacy and show you the light red rash on his body, and he just had a flu last week. 所以说，老王的媳妇呢，带他的3岁大的小孩的儿子来，那身上有一些淡淡的红斑，然后，上个星期他才刚感冒。那通常这种 rash 这种红斑或者这种疹，通常是怎么引起的呢？它有时候could that be drug induced or virus rash? Yeah. 那特别是还有问他 sometimes that kind of rash can be itchy, and some rash might not itch. Yeah. 那这种的话哈，这种如果是感冒 ，normally if the rash happen after they have a flu, normally it could be if they are taking some sort of medication like antibiotic. Okay, sometimes could be the rash by antibiotic, but sometimes that rash it doesn't itchy, and it could be caused by just virus. And most of the time, you don't need to worry about too much about the rash. The rash, because this one is virus rash, and that sort of rash, normally eventually you will go away in maybe a couple of days or a week. So it depends on the symptom. If the symptom they don't have any fever or severe symptom, maybe nothing to worry. But if the patient they have temperature and also have the rash, maybe have to refer to the doctor. Okay, and also Mr. Wang's wife wake up in the morning and felt very itchy alongside the trough. Remember this case? Yeah, normally during the winter, yeah, normally when they wake up they feel very itchy. Yeah, normally that is the dry skin, or when you have the heater. 你在房间里面的电热器让那个 我们的那个空气太过干燥的时候，皮肤过度干燥so it could be the dry skin or caused by heater, and sometimes we have to be careful. Could be shingle, yeah. Especially shingle normally will happen for people 50 years old above, but sometimes can be lower, like 40 something. Is a bit rare. But if the customer is like 50 something or 60 years old and come in, say, oh, I feel itchy, then you have to be careful. Can be dry skin or can be shingle. Yeah. Okay, finish this part. Yeah.